Hello, my name is Tennille Striblin, and the purpose of this presentation is to introduce patients to the new electronic health record system that will be implemented. During this video, there are three areas I would like to highlight. First, the legal initiatives that prompted the change to electronic health records. Second, the concerns that we have for the health facility itself. And lastly, the benefits of using the system. First, let's discuss HIPAA and meaningful use. The Health Information, Portability, and Accountability Act was adopted in 1996. The purpose of this law was to improve the efficiency and effectiveness of healthcare systems. Meaningful use basically describes the how. How do we achieve the goals of HIPAA? How do we effectively use technology? How do we utilize electronic systems safely for our patients? Let's unpack meaningful use. There are four buckets to describe meaningful use. 1. Adopt and use the electronic health record. This is a very direct statement. Find a system to use and implement said system. There are standards in place per the meaningful use requirements that will explain exactly how to effectively use the system. 2. Capture data. How do we actually capture or collect the data? How will we use it? Data capture can affect the way we bill as well as how we actually diagnose patients. 3. Move data. How will our coordination of care be affected with the use of the new electronic health record? 4. Report data. As a part of meaningful use, we have to report the data to all applicable government agencies. This step keeps the health facility in check. The government can monitor information collected and use the data for public health records and analysis. As part of the checks and balances system in place, we have the Office of the National Coordinator, also known as the ONC. The ONC was created by executive order by our then President George W. Bush in 2004. The purpose of the ONC is to promote health technology and monitor how it's developed. The mission of the ONC is to improve the health and well-being of individuals and communities through the use of technology and health information that is accessible when and where it matters the most. To substantiate the organization's mission statement, the ONC created the certification program July 13th of 2010. The certification program issues standards and requirements for facilities to prove that it's meeting the meaningful use standards. The ONC partners with other organizations to complete audits and checks. This certification program qualifies the health facility for monetary incentives. The second task of the ONC is to enforce privacy and security rules. They are responsible for informing us of any HIPAA and privacy rules so that electronic health information is exchanged safely and securely. Electronic health records into health facilities will transform the level of patient health care. The transition from paper records or any previously used system may not always be the smoothest. So let's discuss the barriers that we will encounter as part of the EHR adoption. First, there will be some workflow disruption. Because this is a new system to everyone, the training program can last several months. There may also be some pushback from patients as well as physicians. Secondly, usability issues. The application may not seem as user-friendly as you may like. You may also feel it's too many windows to navigate, or maybe it's simply not as aesthetically pleasing as you may like. Please provide feedback so we can make adjustments if necessary. The initial rollout is not set in stone. Navigation functions and simple interface views can be changed if needed. Thirdly, technical ability. Some users simply are not tech savvy. Our aim is to make this user-friendly so even a technologically illiterate person can use the system. Now, for the last portion of this presentation, let's discuss the benefits of using the electronic health record system. What's in it for you all, the patients? I broke the benefits into two objectives, one being administrative savings and the next being patient-centered. Let's get more in depth. First, the system will provide accurate, up-to-date information. For example, a patient comes in to get tested for sexually transmitted diseases. The EHR system will be connected to the lab, so results will be automatically loaded into your health record. This saves us time and money. Time because the nurse doesn't have to call you unless requested to advise of the results. This saves us money because we don't have to print out test results in order to give them to you physically. Time is also saved in the office because of the use of less paperwork. Generally speaking, whenever a patient enters the office, they are given a printout with their information so that they can modify the data. The patient then gives the paperwork back to the receptionist to update the appropriate information. So instead of coming in early to appointments to update the system, you, the patient, can update your account online at your convenience. The EHR system allows quick access to your patient records. The health information allows for easier exchange for new patients. The previous doctor can upload records to the system. The system is safe and secure and allows us to share information with all necessary clinicians. Next, the system helps us diagnose and reduce medical errors. All physicians are able to view previous diagnoses. The system is connected to clinical decision algorithms that will review data to make educated recommendations based upon the data entered. We will no longer experience legibility issues, which lowers billing errors and enables safer prescribing. The features of the EHR ultimately improves the patient and provider interaction. This is just a brief synopsis of electronic health records. For more information, I have provided the sources used for this presentation. Please visit the sites listed.